Hello, it's Jason at STTEastbourne. Today we are talking about the core and back pain. So, what is the core? Anytime you've ever been to an exercise class, or you've been to the gym, or you've been to yoga, you'll have heard people saying, work your core, work your core. But what exactly does that mean? So, the core are groups or the groups of muscles that make up your internal structures. So their job is to support your spine, or rather, to bridge the gap between the lower half of your body and the upper half of your body. So if we look on the skeleton here, you can see there's a big gap here between the rib cage and the pelvis. So as we put the muscles on, these muscles here start to provide support to the pelvis and to the rib cage. We put more muscles on, they start to bridge the gap. These muscles here, called the psoas at the front, and the muscles at the back of the spine here, called the QL, quadratus lumborum, and the multifidus or multifidi here, bridge the spine, and their job is literally to keep you upright. They do move, they are active in movements, but their main job is to fixate, to keep you supported. So when it comes to working your core, the best way to work these muscles is not actually through movement, but is through what we call an isometric contraction. So if you think of the plank exercise, you are contracting those muscles, but they're not moving, they're just held in place. And that's the best way to train these muscles. So I'll never ever say that any form of exercise is bad, because all exercise is good. Anything that is using your muscles is always good for you. But the type of exercise that is best for the core is things like Pilates and yoga, where you are engaging the core in an isometric fashion. So if you've got back pain and you've got issues with your back, then strengthening your core will really help. And you can do some exercises without actually having to be at a gym. If you're sitting on a train or driving your car, you can engage your core. Ladies, you might think of this more as your pelvic floor, but if you pull essentially your bum to your belly button internally and try and squeeze the two together, hold them for a few seconds, release, and keep repeating that, you're working your deep core muscles, or some of them. You're working your pelvic floor. And that is a good thing. Anything you can do that helps towards developing a stronger core is better. When you're sat at a desk, you're using your lower back muscles and your erector spinae muscles to support you, but you're not engaging your stomach muscles. So you get an imbalance, and therefore doing anything that works those muscles and helps you be more balanced is a good thing. If you look here, you can see that damage to the disc is, there are different types of damage. You've got a normal disc, a degenerated disc where the disc is broken down, a bulging disc. This pushes onto the spinal cord, causes back pain. Herniated disc, same but worse. A thinning disc comes from age, as does disc degeneration. None of these things can necessarily be fixed by exercise or by massage or by soft tissue therapy, but by working on the muscles surrounding them, you can provide a much more strong support to that area. So if you want to know more, if you've got any issues yourself, particularly with your back, come and give me a call and let's book in, let's have a chat. My number is 07980 339 864, and I'm happy to book you in. I do evenings and weekends. So once again, 07980 339 864, or you can email me at jason@otteastbourne.com. So any soft tissue issues, come and see me.